After using our SWOT to determine which element of care management could potentially be improved, we decided to again focus on appropriate education for both patients and caregivers. Um, Education would enhance communication to prevent barriers in care among patients, caregivers, and the multidisciplinary team. For example, knowing when appointments are and with whom, which can cause confusion post discharge, what the plan of care would be, and what is the next step post discharge, if it is a follow up appointment, or is it testing, or is it meeting with a specialist or dietitian. Also, providing patients and families with the tools they need to be successful to stay healthy, such as with looking for warning signs for heart attack, how to prepare for stress testing and additional procedures, reduction of risk factors with smoking, hypertension, and diet, knowing what the role of the caregiver is and what could potentially lead to caregiver burnout. Also, education will reinforce goals to help improve outcomes. Setting measurable goals, such as with diet and exercise, and even if compliance with educational classes could enhance heart health. And lastly, creating educational guidelines and protocols, such as the protocol we discussed earlier, stress testing 5 days post discharge, giving educational packets upon discharge, and even adding a follow-up call within 24 hours post-discharge, especially for those patients that are at low risk who have never experienced any sort of cardiac event and are unsure or unclear of how they're feeling or may have additional questions.